Good afternoon. My name is Derek West. I'm an interventional radiologist, assistant professor at the University of Texas at Houston Health Sciences Center. I'm here to talk about diversity and inclusion in radiology. So what is diversity? A simple definition of diversity is many different parts, many different pieces. That's really all diversity is. It's just when you look at a rainbow, you see all the different colors. It's all inclusive. But diversity in and of itself, in the practice of medicine and in business, is useless without inclusion. Inclusion is not just having representations of different sectors of society, but that they feel included, that they participate, that they are a part of whatever is going on. That's where the real value of diversity comes in. How does that apply to medicine, and specifically, how does that apply to radiology? I'm an interventional radiologist, so I'd like to use this as an example. What is the patient population that most commonly gets uterine fibroids? The answer is African American women. Now, how many African American women interventional radiologists do you know? There are very few. Why should this matter? Studies have shown that patients are most comfortable with physicians that look like them. Now, I'm not making a judgment call on this. I'm not saying that you have to have had a broken arm to know how to fix one. But I am saying that patients are more comfortable with someone who looks like them. Our lack of African American female interventional radiologists may in fact be hurting our patient satisfaction. How do we fix this? How do we increase diversity in radiology? The first question is, where do we stand? The answer is, in 2012, the American College of Radiology looked into this and published a series of papers. These papers examined diversity in radiology. Radiology is among the least diverse specialties in all of medicine. It examined ways to improve that. They suggested pipeline programs. They suggested outreach programs. And they suggested diversity training. Now, while I can't go through all of those in 10 minutes, I will give you a couple of tools that perhaps you can use to assess yourselves in diversity. The first thing is something called the Implicit Association Test. A test is not just one test, it's actually a series of tests that Harvard publishes. These tests can assess your level of implicit bias as it pertains to race, ethnicity, sexual orientation, gender, religion. It can even look at whether you have biases against people who are poor or rich. So this gives you some sense of where you stand personally in terms of your personal biases. And it may reveal some that you don't even realize that you have. The second thing is something that the American Association of Medical Colleges has been really pushing hard. And it's called unconscious bias. Unconscious bias is the bias that you bring when you have an interaction with someone else that you don't even realize you have. I'm an African American male. If you are a physician and you're meeting me as a patient, you bring to the table all of your experiences that you've had with African American males. And that screen sometimes prevents you from actually seeing the patient. So the first step is recognizing that you bring this to the table, whatever those biases are, and then moving them aside so that you can actually see the patient. The AAMC has a lot of information about this on their website. They also have training courses on this, and I strongly encourage all of you to take a look at those. But again, going full circle, the importance of diversity training isn't just for the sake of having training. What benefit do we get out of it, particularly as radiologists? And the majority of you out there are not interventional radiologists, so you don't have a lot of patient interaction. The answer is workplace environment. If we are indeed committed to increasing the number of women and underrepresented minorities, this is the type of training where it begins. In order to make underrepresented minorities and women feel included and to get the full benefit of diversity and inclusion, this type of training is important and necessary. Thank you.